Dr. Puri, welcome to this webinar. And the first question that I'd like to ask you, we have been associated with Indian healthcare and health insurance for many years, close to 40 years, as an ace doctor and keen strategist. Tell our viewers, how would the current strike of COVID would impact the Indian healthcare?
Thank you, Dr. Abhijit. It's a pleasure being on this webinar. This is not a good time. I don't think it's a good time for healthcare delivery, healthcare insurance, in fact, for any industry, nor is it a good time for the countries, the world.
Right, sir.
The pandemic is affecting each and every pore, each and every constituent, and it's really after more than 100 years after the Spanish flu that the entire world is feeling really helpless, because we don't have a solution as to what we can do to contain or control it. So I think healthcare industry in India or health insurance industry in India cannot be insulated from what is happening around the world.
Dr. Puri, it is imperative now that the Indian healthcare has to change drastically post-COVID. Is it not the time to embolden our preventive primary care and disease management?
Absolutely correct. I don't think the policymakers have ever had any other thoughts. The problem has always lain in implementing it. As far back as 1943, Sir Dhore Committee had sat down. At that time, India was not independent, but that subsequently was ratified by the independent India as well, by the parliament.
Right.
The Dhore Commission had very clearly laid out the groundwork, done the groundwork and laid out the plan as to the fundamental basis of how the healthcare system in the country would be formed and run. Unfortunately, from 1943 to date, that hasn't changed much. The emphasis on primary and preventive healthcare in a country such as India has to be the way forward. That is realized. Ayushman Bharat was the first attempt, I think, towards a universal health scheme. It was also the first attempt, in my opinion, as to the government ultimately understanding that it is not possible for it to continue to provide all forms of the care to the people, and they will have to involve the private sector. And therefore, this Ayushman Bharat allowed the private sector to participate in it. Now, the reason why it has not succeeded to the extent that it should from the perspective of private sector participation is a different matter of debate. But suffice it to say that I am totally in agreement with you that the way forward for this country has always been, and it has been re-emphasized by this epidemic, must lie in preventive and primary health care.
Right, sir. Right, sir. Dr. Puri, you have been also associated with the health insurance industry as independent director of Manipal Sigma Health Insurance, also a former executive director with Max Bupa. To what extent do you think health insurance business has been affected due to COVID? There is cases of huge bills. I would like to have your perspective from healthcare delivery side.
Well, first of all, a correction. I was with executive director with Max Healthcare, not with Max Bupa.
Right. But yes, I am an independent director on the board of Manipal Signa.
Right.
I think the important point from the healthcare delivery side of the current scenario is so dismal that a recent FICCI EY report has painted a picture, I think correctly. It shows that the quarterly losses are to the tune of something like 13 to 22,000 crores. And for an industry which was not in the pink of health, with an EBITDA margin hovering around 13% or so, this is a very, very bad scene. The reasons are threefold. First of all, the footfalls have fallen, partly because of fear,
Yes.
partly because of the fact that the lockdown and containment zones have not allowed the person to travel unless it is an emergency. And the majority of the hospitals rely on elective surgeries and outpatient work. Emergency surgeries are known for much less.
Right.
The second main reason is that there is zero traffic for medical tourism.
Right, sir. Right. Sir.
And the third is the cost factor.
Right.
That now to deliver whatever care was being delivered
Right.
now requires an additional expense of the personal protective equipment, gloves, masks, etc., goggles, etc., which is an added cost to the inventory. And last but not the least is the fact that the hospitals, partly because of humanitarian reasons, partly because of business reasons, cannot afford to let go. So hospitals are functioning at full capacity from the point of view of staffing, etc. But the number of people utilizing the same services have fallen. So these four factors, I think, have contributed massively to a situation where we are now focusing on somehow pulling through 1 month after the other in an ability to be able to pay bills. That by itself is becoming a huge challenge. So I think we are in very bad shape, and we have petitioned the government for a bailout of some nature, or we have identified the areas where we think the government can step in to help us. But the fact of the matter is that if we are not getting the patients, health insurance won't get the premium, the patients either.
Right.
So I think we are sisters as far as both health insurance and health delivery systems are so heavily intertwined that they can only be called as siblings. And I think it's just unfortunate that health delivery is so badly affected at the present moment that it will take quite a while for it to recover. And it will require a huge effort and hopefully an answer to the COVID pandemic before we reach a stage of some kind of semblance at least of stability in the health sector.
Do you think post-COVID people will go for more health insurance in days to come?
That's a very good question, and I've been pondering on that. My feeling is yes, people will. There is no greater inducement to human endeavor than fear. And this COVID pandemic has instilled a fear which is unprecedented in the minds of the general populace. And it's also a fact that when people are afraid, particularly of the elderly age group above the age of 50 and with comorbidities, and India is full of comorbidities, then they will be really worried as to how are they going to pay their bills. My feeling is that going forward, a larger number of middle-class Indians will seek health insurance than was the case earlier. It is a very ironical and in a way pathetic situation that COVID might well act as an advertisement for the health insurance industry in India in future.
My last question is that what is most health insurance company do not really look up for the geriatric healthcare needs. They do have policies, but unfortunately those policies are not as per the geriatric healthcare needs. And the healthcare institution also remains the same, that is hospitals. Most policies triggers because of hospitalization. Do you think home care and palliative care has a great future in India, and there should be embedded into a health insurance policy in days to come?
Yes, I think certain moves have been made over a period of time by IRDA in relaxing what were otherwise very, very strict norms. And anybody over the age of 60 really had no recourse to any kind of a policy. But now, with the liberalization of some of the rules, you at least have some kind of an option available for at least 65 years easily. And beyond that also, in certain cases, particularly if you have already carrying your insurance for a certain period of time. I mean, there are certain riders, but ideally what should happen and what has happened in Ayushman Bharat, for example, is that pre-existing disease and age do not have a barrier. Ideally, in an ideal world, that is how it must be. The problem is that in India, we have not had a very large populace getting insured. How will insurance industry survive if the healthier number does not override the number from the point of view of those who are seeking attention?
Okay, right.
So otherwise, it's never going to make sense from a business perspective to have an insurance company running if everybody was claiming. I mean, you can't have a situation like in motor vehicle insurance or in earlier days of health insurance, where 110, 112, 20% was the utilization, and the intake was actually being supported by other insurance companies, other insurances, bailing out the health insurance. That cannot be the way forward.
Right.
But you're absolutely correct in your assumption. In going forward, we will need to factor in both home care as well as geriatric care. I think we are on the right track because, as you see, going one step at a time, IRDA has brought in certain liberalization. Now you have a standard policy, you have specialist policies available for cancer, etc., etc.
Right.
And you also have the portability plan.
Yes,
and last but not the least, recently the involvement, the addition of mental health.
Right,
is
that's a
big
great step. Right, sir.
Because that's a very large populace, and this number is going to go up. At the present moment, of course, very few mental disease patients get admitted, and majority of our policies are inpatient policies. But the fact of the matter is that we are moving in the right direction. As long as the intentions are right, I think we will see daylight soon.
Thank you, Dr. Puri, for joining this seminar. I would have loved to have you live on there, but anyway, thank you so much, Dr. Puri, for joining this webinar.
Yeah.
Thank you so much.